All right, guys, a lot of times patients will be dealing with different parts of our office, dealing with front office staff versus myself or people what we call in the nurses station, myself, my nurses, my medical assistants. And when you're approaching these people, I'm sure you have lots of different questions that you want to ask. Which questions are more appropriate for the front office versus the nurses station? So in our office, the front office deals with everything insurance related. So if you have questions about your copay, about coverage, about authorizations for your procedure, then those are questions for our front office. If you have any questions about scheduling, it's very rare that I know when my next availability is. That's definitely something that my front office staff can dive into the schedule and figure out. If you have questions about rescheduling, next available, or if you want to get one of your friends in for another visit, then ask questions about that to my front office staff. As opposed to that is my nurses station staff, which includes the nurses, the medical assistants, the medical assistant supervisors, and then myself directly. And so that's where you want to ask your medical questions. Reactions to medications, responses to procedures. If you can take one medication with another medication, that's where you really want to take advantage of the medical knowledge that the nurses station staffing has. They'll be able to tell you when to take your medications before a procedure, how long a procedure is going to last, what are the common side effects that could occur, what the next procedure might be. Certainly you want to ask that to myself or one of my partners, but if we're not available, then our nurses and our medical assistants can answer that. Briefly, anything that you think of that would be quote unquote administrative, insurance related, that's in the front. Anything that's medical related, that's at the nurses station.